This podcast has been developed with the intent to inform and educate the general public and providers and should not be relied upon for any other purpose. The content, views, and opinions expressed in this podcast are those of the speaker and not those of the San Diego Psychological Association. On this episode, we will explore the role of the endocannabinoid system in health and disease with our guest today, Dr. Michelle Sexton. She formerly studied the endocannabinoid system for 6 years through her fellowship at the University of Washington and has continued her research into health effects of cannabis at UCSD. Welcome, Dr. Sexton, and thank you for being on the show.
Thank you for inviting me.
Yes, I'm actually really excited to talk about this because this is one of those topics I feel like has significance to who we are as humans and our development as human beings. And yet there's so little discussion on the importance of the endocannabinoid system. And when we talk about this, I think the cannabinoid piece and then branching out into cannabis is what most people recognize. And yet there's so many misconceptions and things that I think we could talk about and clarify today. Do you agree?
Oh, yes, I totally agree. I think that it's a fascinating system and we can tone it in many different ways.
Oh, yes. I let's jump in. Actually, before we get started, if I, and please correct me because obviously you're the expert. If I understand this, one of the things that I think most people in the general public are familiar with the fight or flight or freeze discussion, and that being more related to the sympathetic nervous system or the autonomic nervous system in general. But yet most people don't know about the ECS, which is very critical to every aspect of our functioning. Basically, my understanding is that it regulates and controls many of our most critical bodily functions, such as learning and memory, emotional processing, sleep, temperature control, pain control for people who have chronic pain, inflammation, and even eating. And from what I understand, you had a previous research. Was it neuroinflammatory research that you were doing before?
Yeah, we were studying the role of the endocannabinoid system in neuroinflammation and neurodegeneration.
Wow, that's fascinating. So let's break this down. How, in our simplest form here, what is the endocannabinoid system?
So it's a complete biochemical system. And by that, I mean our body makes cannabinoids. Those are the endo or within cannabinoids our body makes. And then they bind to receptors in our body, protein receptors. And then after they bind those receptors, they can also be broken down by enzymes. And this is what makes it a complete system. And so that system is functioning internal to cells in every tissue and organ in our body.
Wow, that's remarkable. So yes, here again, it plays such an important role of our day-to-day functioning, and yet there's not a lot of conversation about the significance of the endocannabinoid system, at least not that I hear as much as we hear about other. And of course, I'm surrounded in the mental health field. So this is why I think this topic is so important, because this actually does matter in mental health, along with every other functioning aspect of us being human beings. So to understand this a little bit better, you mentioned tone. So with the system, it sounds like because it regulates so much, what does it mean when you say, how can we tone our endocannabinoid system for health?
Well, when I think of tone, I think about exercise, and, we can exercise to build muscle, or we can just exercise to keep our muscles in good tone so that they're not wasting or lacking strength. And so I think the same theory, applies to the endocannabinoid system, that, we don't need it overpowering or underpowering. We just need it to be at its normal, healthy level, because it is a system of homeostasis. And interesting about it compared to some other systems, like if you think about the internal opioid system that we have in our body, and when you hit that system with an opioid drug, there's this tolerance to develops and there's withdrawal that develops. Mm-hmm. Well, because this endocannabinoid system is so involved in that homeostatic aspect of other systems, it can kind of go up and down a little more easily
Mm-hmm.
and readily. And it turns out there are foods that many of us eat on cannabinoid receptors. So that's one way to tone the system, is just by eating foods or having food as medicine.
Oh, that's fantastic. I obviously there are different facets of how we can make sure that we have a balance or homeostasis within the body. I'm glad you brought up something that I think is really critical to keep this relatable. I think not only in general, but to mental health. The opioid epidemic in this country has been something that is well discussed and researched and is at critical levels where we see fentanyl overdoses, unfortunately, occurring at, more than rapid rates. And, cannabis, I'm curious because cannabis is actually part where it binds to these endocannabinoid receptors in our body, in our brain, correct? So I'm curious for you as a researcher, and this is a really big question out there. Feel free to tell me if this is relatable, but can cannabis be used as a monotherapy or as an adjunct with people with chronic pain, for example, instead of opioids?
Well, I'm glad you asked that question because this was how I initially got involved at UCSD, was through the pain division, which is part of the Department of Anesthesiology. And so the person who's been chair there for quite a long time, Dr. Mark Wallace, he had been employing this with patients for quite a while, probably since around the time cannabis was legalized for medical use in California. And so that's how we got connected. And he brought me into that department specifically so that I could be able to go into the chart system so that when he wanted to refer patients that he was trying to taper down on their opioids, I could go in and read the chart and really fully understand the patient history as well. And so we worked together since about 2016, actively tapering people off of opioids using cannabis. And now it's evolved a little beyond that, even where, now cannabis is often, or I would say most of the time, being offered before an opioid medication.
Oh, that's fantastic to hear because, there's a lot of contradictory reporting, and I think it's become somewhat politicized. I'd love to hear your thoughts on this because personally, I'm people who listen to this or know me, I nerd out and I like to read different medical journals and I like to read, this is some of my spare time fun. I don't know why, but yes, I really noticed that this particular topic of cannabis seems to have become polarized and politicized where it depends who funds the research now sometimes. And that's really unfortunate. But, for example, there's contradictory literature where does it increase anxiety? And then the bias in the literature seems to be saying, yes, it does for people who are, trying to claim this as a addictive drug. And then on the other side, we see research that says, no, it's not. It doesn't create anxiety, can help actually lessen anxiety, things like that. Can you help here a little bit and clarify this data? Because I think that can be so helpful for listeners who are confused about cannabis and the endocannabinoid system.
Well, you asked really the perfect question because with both, you mentioned anxiety and pain specifically, but it could apply to many other things as well. And this also is a concept that applies to a lot of compounds or different drugs. And it's called hormesis, but in pharmacology, it's called biphasic effects. And so as it applies to anxiety, for instance, it's pretty clear from the literature that low dose of THC, because when we talk about cannabis working on the endocannabinoid system, the primary ingredient of cannabis is delta-9 tetrahydrocannabinol, or what we call THC. And that's the one that actively binds these cannabinoid receptors and is very powerful at these receptors. So at a low dose, THC is anxiolytic, or can reduce or cut out or wipe out or eliminate anxiety, depending on the person. But as you go up in the dose, it's pretty apparent that more and more people will experience the onset of anxiety as the dose gets higher. So this is where I think the medical use, it could really be helped, with people getting accurate medical advice about it rather than going to a dispensary and getting advice from recreational users. So the same concept appears to apply also to pain. So Dr. Wallace, again, he's done several pieces of research on inhaled cannabis for neuropathic pain. And in the most recent study, they did a secondary analysis of blood levels and found that there were blood levels that correlated with optimal pain benefit. And that can go along, with the potency of the cannabis being used. And so it was very low potency cannabis. It was 6% THC, which is probably a third or a quarter of what you can typically buy in a dispensary. And as you go up in the dose, that the pain benefit was actually lost. And then we get reports of patients, experiencing worsening or exacerbation of pain at high dose.
Right. And also exacerbation of paranoia and anxiety. Is that right?
Yeah. As you go up in the dose, you lose the pain benefit, you lose the relaxing, calming benefit, and then you can totally turn it in the opposite direction. And that's what hormesis is. That's the concept of hormesis.
Oh, that's very helpful. I think this is where it's important to get this clarification, because for people listening, there's multiple topics here that I think we can address. But the first is the misconception that cannabis is detrimental in this way because of what you're describing. It sounds like as if the THC, I just want to make sure I clarify, if the THC level is lower, there are tremendous benefits. There are things, and actually, if I'm recalling my history correctly, it's only recent years where we're seeing these levels of THC be so high, where in the past, if we think back to Woodstock and, the times, where the THC content was much lower, it wasn't like that. People were able to experience the benefits, whereas now it's so high, these THC levels are so high that we're seeing a lot of negative responses and behavioral responses. Is that accurate?
I mean, there's a lot of debate over whether it's really increased in potency or not. I mean, if you go to the scientific literature and you look at the early data, like THC was first isolated in 1964, and soon after researchers were able to get, THC so they could start doing quantification. And so an early report out of the University of Mississippi of just this was, cannabis that had been seized like by the FDA in raids. And the average potency was about 10%. So, we don't know exactly where all of that was coming from. Now, there may have already been people in the United States that were growing it and achieving higher potencies. It just wasn't, what was reported. But definitely, if you go, you could go to any dispensary website and just browse through their flower content alone. And ridiculously, you'll sometimes see it labeled at 40% THC.
Exactly.
Well, that is implying that this plant can make a single compound 40% of its weight, which is just, I also studied botany and have an agriculture degree. And it's kind of like, really?
Wow.
That's quite extraordinary that it could make 40% in its weight. So we don't know if these plants are actually making that amount, if they're spiking it, if the labs are misreporting. But if you go on up the scale of different extraction technologies, some of these products being sold on the market are 90% THC. So we're now talking about a purified drug almost.
Wow.
It's a totally different animal than saying cannabis, which is a plant that flowers.
Exactly. I'm so glad you said that, because I think, and this can segue a little bit into addiction and discussing. So I talk to a lot of parents, and, the biggest concern is, especially here in California, it's been legalized at a lot of parts of the country, actually, where we're seeing this be decriminalized. And, of course, I think that there's a lot of positive behind that for various reasons. However, what you're describing is with this, it's not regulated with this selling of this quote unquote product. There's not a lot of regulation in this way to where people can really know that they're getting the benefits they're looking for with the content and with the medical purpose, unless they get this type of information, right? Like what we're talking about.
Yeah, and this is why we need it to be removed from Schedule 1, because until it is, it can't be regulated.
Exactly.
You know, and it has set up such a huge problem, just as you described, where, we do have state regulations, but in terms of using it as a medicine, it kind of shuts medical providers out in a way, because it's not subjected to quality control that other medicines are subjected to. That said, I do want to say, as a caveat, cannabis is subjected to a much higher standard of quality control than any herb you can go buy off of a shelf in a drugstore.
Right. And also other drugs, that it's Schedule 1, meaning the highest form of regulation in that way, correct?
Well, regulation in terms of access. I'm talking about the quality control regulation.
Oh, got it.
It's like what you're getting, does it have pesticides on it? Do you know the active ingredients there? We know these things about cannabis in California because our state has said cannabis has to be tested for all these things. But other herbs, you could go buy some chamomile off the shelf and you don't even know if it's really chamomile or not. Nobody has quality controlled it.
Oh, that's fascinating. Yeah, that's also a controversial piece, right? So when we talk about neuropathic or homeopathic remedies, that yes, I have read that cannabis is one of the ones who are the highest level that we have to disclose this information based on the law, which is remarkable, wonderful. And I'm glad we're getting some clarity for people listening who are confused about this, right? To understand the difference between medicinal dosing and what could actually, in fact, be more harming, which is, these going to a dispensary and just getting a high content THC, which at this point, from what I'm hearing and what you're saying, if I'm hearing you correctly, it no longer is cannabis in that way.
It's an extract of cannabis. It doesn't contain everything in cannabis, and it's been hyper concentrated.
Right. On that note, there's another piece of this that I'm curious about, because this has been a new thing, newer. I will say I'm not exactly a aficionado in this, but, CBD, specifically for people who have, pain or inflammatory issues or require some assistance with this. There seems to be a new division now, if you will. I'm using my words here a little differently, but where this is branched out, where CBD has no THC content, but is also used for pain and other things. What do you make of this? Because I have no knowledge really on this particular component. So I'm so curious, or very limited. Can you tell me a little bit about that?
So cannabidiol it's pretty much what's considered the secondary cannabinoid in cannabis right now. And that's because breeders started breeding cannabidiol back into the plant after they had bred for very high THC content for a long time. And there was some data that had come out of Brazil. Dr. Carlini had published that adults with epilepsy had gotten benefit from CBD. Well, this just caught the imagination of the pediatric epilepsy community back around 2010, 11, 12. And, these are desperate parents with children with intractable epilepsies that is uncontrolled by conventional medications. And, I think in some ways, unfortunately, those kinds of situations can be preyed upon by the natural products industry. But it did turn out that cannabidiol was also effective in these children. There is now an FDA-approved drug called Epidiolex, which is a purified CBD.
Oh.
And the caveat about CBD is that, to achieve this efficacy for epilepsy, for instance, it requires very, very high dosing. So in these children, it's up to 20 milligrams per kilogram.
Oh, wow.
And so, if you think an average adult might weigh around 65 kilograms, 20 times 65 is not an affordable dose, on a daily basis. Mm-hmm. And so I think that's one of the hugest misconceptions about cannabis and CBD, and thinking that CBD can be this replacement for THC. They're two totally separate pharmacological entities. CBD does not bind cannabinoid receptors. They're not equipotent. Just because 2 or 3 milligrams of THC might help you sleep through the night, that doesn't mean 2 or 3 milligrams of CBD is going to do anything for you. So it's getting more research now that we have an available drug to research, but there's no results in yet. There are studies that have come out from around the world, and at this point, none of the studies have suggested or validated that CBD treats pain. And I have to say that my own experience clinically, probably with around 1,000 pain patients to date, is that they come in the door telling me they've already tried CBD and it didn't work. That's why they're in my office.
Okay. That is so helpful, because I think there's another facet here where it's the actual information has not been significantly verified here, and we're just getting more of the marketing and sales of a product. Exactly. So it feels more kind of like what you were talking about with like some of these herbs that are not necessarily heavily researched or regulated. It's kind of feeling like the same thing then, because some people swear by it, but of course then I think, is this actually working? Or is, this some kind of pseudo response that a person's having, which is not actually, it's more of I'm blanking on the phrase I want to say here, but
placebo.
Yes, thank you. I've got so many thoughts.
And usually if it is a placebo response, it does wear off eventually.
Right. Exactly. Because
people might tell me, well, it worked for a day or two. I think it's because they had such an expectation, because there's so much hype that is built up around CBD. I think it was done purposely by the industry, certain industry players and organizations that, want cannabis legalized. They saw this as a way to legitimize it. It's the non-psychoactive cannabinoid. Oh, it can do everything THC can do, but this is not backed up by the science.
Thank you so much for that clarification, because again, I know myself personally, I try to read and go through stuff, and I don't have, like you said, there's limited data, there's limited information and research on this. So for me personally, even prior to our discussion and looking up, some of this literature and things I've read before, I don't have that information. So if, people like you, are researching it, you can tell us, I didn't know, right? So just you telling, people who are listening, who are confused about what cannabis actually is, the benefits and the differences between THC and CBD. These are really, really important information. And I want to come full circle because, I'm thinking a little bit about addiction. I'm thinking about the developing brain. I talk to parents, and there's a concern, I was mentioning earlier, that, California, particularly in other states, have now decriminalized and legalized, for recreational use, cannabis. And I want to get your feedback for any parent who's listening or anybody who's concerned about addiction. Tell us a little bit about your thoughts here, and maybe what would be helpful for parents who are listening that are thinking about their child and functioning. I know the prefrontal cortex, as we know, the dorsolateral prefrontal cortex is not fully developed until mid-20s. So what impact does any substance really have, but specifically cannabis?
Well, this is a question I had to grapple with, because I was living in Seattle. I had teenagers, cannabis was widely available there. It was already medically available. And the PI that I worked for, this was his story at the time. And I still like this story. And I think it's been, as time goes on and we get more research that it's a valid theory. So if you think about the time of adolescence, it's this big time of differentiation, trying to find out who we are, not being like our parents. So, we're out there experimenting. We're trying out things. We're doing this, we're doing that. We're trying alcohol, we're dancing. Whatever we're doing, And so because the endocannabinoid system plays this huge role in memory consolidation, his theory was that if an adolescent is using cannabis and going out in this process of differentiation and having these experiences, that they could go out and have a very negative experience, but it's not getting consolidated into their memory. And that was one of his biggest concerns, which I thought was fascinating. And, what really, builds upon those concerns is that we know from the time of earliest embryonic development of the central nervous system that the cannabinoid 1 receptor is on the leading edge of neurons as they go out to make their connections. And so that, the endocannabinoids, anandamide, 2-AG, are calling those neurons out to make connections. That's still going on as long as our brain is developing until the late 20s. And so if you throw THC in there, there's a big question mark of, well, now what happens? It binds the receptor more easily than our own endocannabinoids. It has a higher affinity. So it could knock them off, and, they wouldn't be able to have their roles in the developing brain. So I think that's a concern, just about brain development in general. But there's also very good data, strong data showing that adolescent use is pretty predictive of depression and or anxiety in young adults. Probably a lot of people have heard about the potential connection with schizophrenia.
Yes.
It's unlikely that it's going to cause schizophrenia on its own, but if kids are out there using these very high potency products and they have a genetic predisposition, it's a very plausible situation. There's huge data bases of this out of Denmark showing this. So, those are some of the mental health things that aren't addiction. And then when you come to the topic of addiction, I had to struggle with this with my kids. Cannabis could also kind of be viewed as a harm reduction approach to using alcohol or other drugs. There's not good evidence that it's driving kids towards using other heavier drugs necessarily. But I remember my daughter got in trouble, and I won't say a lot more about that, but we had to go to, some parent thing, and the kids had to come, and we were in this all-day thing with a counselor. And she was going on and on and on about alcohol. And, these kids were just bored until finally toward the end of the day said, well, I kind of get the sense that alcohol is not the drug of choice of these kids. And these kids just exploded into applause. So she had been spending her entire time talking about alcohol, but that wasn't the drug they were using. On one hand, you could think of it as potentially harm reduction, but then when you think about the potential mental health impacts, it's not. I think just, having frank conversations with kids about it rather than making it taboo is important. Trying to get them to understand the impacts of what it could do to their developing brain or their mental health.
Thank you for saying that. I agree. I think transparency and discussion is significant with any of these types of situations, specifically because they're, again, just in our discussion here, you clarifying, the content level of THC in these recreational products versus what actually is effective for sleep and for, the body systems. This is information that, most people don't have. They don't have this knowledge. So I think adolescents having that information is equally as important, and for them to understand the functions of the brain and how it develops, and that anything that we put into our bodies, from sugar, which we see can spike, dopamine levels. We can see the different, responses to different types of any substance will create changes if we do it in certain quantities or certain ways, things like that. So, and when you say harm reduction, I think it's important to clarify that means reducing the use of one substance by substituting, right? Cannabis, that's what you mean, in order to reduce another substance. So that is effective. We actually do use that as a mechanism, as an intervention for people who do have addiction. So I think that's really important. I wanted to circle back real quick because I think, when it comes to having these discussions with, parents and families, if I'm hearing you correctly, would you say then, harm reduction / abstinence of some of these things then for teens and for children? And then, once the developing brain is the prefrontal cortex is in the mid-20s, it's solidified, so to speak. We can always still learn, but we don't have that, that malleability, right? is that a better time to use cannabis?
I mean, in an ideal world, yes.
Okay.
Unfortunately, we live in a time and in a society with high stress.
Yeah.
The topic of trauma is really coming to the forefront, adverse childhood experiences, and, the inaccessibility of seeing therapists or psychologists. Insurance is not paying for this. There not being enough of them in general, stigma around seeing psychotherapists or therapists. So unfortunately, people turn to drugs for escapism.
Mm-hmm.
So, and this includes, children and young adolescents, older adolescents, all across the board.
Mm-hmm.
So yeah, in an ideal world, abstinence, but, it's not going to happen in a lot of cases.
Mm-hmm.
And, I think this is an interesting place where the endocannabinoid system and trauma kind of come together, because that hypothalamic, pituitary, adrenal axis is under the direct control of our endocannabinoid system.
Mm-hmm.
And this probably explains why cannabis is such a good hack, for chronic stress or anxiety. Unfortunately, it's hacking it. It's not really treating the cause, learning how to cope with stress. It has nothing to do with learning stress reduction tools or anything like that. It just kind of shuts down the signaling so that you feel better during the time you're under the influence.
Right.
Right. But it just really highlights how important it is, for all of us to start talking about trauma, acknowledging our own trauma, acknowledging trauma that we have experienced with others or that we have done to others. And then what does it take to heal from that? And it takes a lot, because if chronic trauma and chronic stress lead to chronic inflammation, and the number one thing that victims of trauma are going to do is become addicted or use substances.
Mm-hmm.
And then, after that come diseases, cardiovascular, kidney disease, mental health disorders, cancers, all can be traced back to sometimes generations of stress and trauma.
Absolutely. I so glad you highlighted that, because I want to focus a little bit on trauma as you were talking. When we think about addiction, I often like to put it in the category, as you said, escapism. I really like the way Dr. Richard Schwartz, founder of Internal Family Systems, he talks about coping mechanisms that are maladaptive, but yet it's a coping mechanism. These are firefighters. These are things putting out fire in our emotional sense and our well-being. And that is, drugs, gambling, sex addiction, whatever we want to label. These are forms of coping, even though they're maladaptive. Eating disorders falls in this. And, it's hard, because if we don't have mental health in the very beginning of development, meaning that children, are allowed to identify emotion, understand and process effectively, that we're giving this information to parents, we're allowing people to have access to mental health care and learning coping mechanisms, as you said, and learning how to process trauma, they're going to fall back on these other substances. So cannabis, as I'm hearing you, and as I personally have read the literature and my own opinion here, is it has tremendous benefits when it is used appropriately, right? But when it is used as a firefighting mechanism and effective coping is not used, we see a detrimental effect. And I think that's really important to lay out there, because we're not condemning cannabis. If anything, I think you and I are talking about the absolute benefits of the use of cannabis on multiple different, levels for people, but that this isn't meant to hack. As you said, I love that you said that it hacks our system, versus it actually being a fix. And I think that really stuck with me when you said that. And I also read a little literature, and maybe you can speak to this as well, talking about post-traumatic stress disorder, so PTSD, and that it plays a part in memory. Like cannabis and the use of cannabis and THC, as you were mentioning, in lower doses, can actually help not remember, so to speak, some of these negative experiences or traumatic experiences. Is that accurate? Is that what you were referring to earlier?
Yeah, that's very accurate. This has been shown over and over in animal behavioral models, and it's considered to be the extinction of aversive memory. Because you can train animals that when a buzzer goes off, they're going to have pain, right? But can you get them to forget that? And that's the extinction of the averse memory. And this is where, again, THC plays that role.
We were talking about PTSD and trauma and THC and the effects of how this benefits in memory. I think that would be so helpful for us to get that information out there.
People who have PTSD, we know that there's also this effect of the inability to extinguish these adverse memories. And even though, people with PTSD, their behaviors may improve over time, they may have fewer triggers and learn coping techniques. One thing that they may not ever get rid of is nightmares, or sometimes even night terrors, although that's more common in children. And so that's one thing that's been looked at in patients with PTSD is, specifically treating sleep with cannabis. And there have been several studies, but a recent one where they had, I think it was around 120 subjects with PTSD using cannabis and showing that they did report improved sleep and less frequency of having aversive dreams.
Wow. That's fantastic. And this is where cannabis does have that piece of beneficial aspect for sleep. And the part that to me was most interesting is that connection to memory, that there is a benefit. I did not know this until I read the literature, that there is this significant research, a body of research that talks about how it can help extinguish those negative adverse childhood memories and trauma and experiences. This is just fascinating stuff. I think overall, I've learned so much in talking to you and just reading the literature here about cannabis, the differences between THC, CBD, the benefits. And I think this is just a great information to get out to the general public. Is there any additional points that you think would be helpful for the people to know about the endocrine system and the endocannabinoid system, now bringing in the endocrine system, the endocannabinoid system, and, just in general?
I think really the only thing that we didn't touch on that is important to me, I used to be a midwife. I'm also a mother. I suffered horribly from hyperemesis gravidarum, or morning sickness that was debilitating. I remember at the time thinking, I wonder if cannabis would help. I mean, I was very desperate, and now there is this huge uptick of young women who are pregnant that have a perception that cannabis is absolutely safe for pregnancy, whether for treating morning sickness, for treating anxiety during pregnancy, or just using it, as a substance while pregnant. And I think this is an important message to get out, that the role of the endocannabinoid system in the developing brain, again, is very important. And I think there are a number of researchers that are looking forward, thinking, what are we going to see in 15 and 20 years from now in children that were exposed in utero to these dabbing, vaping, of these very high potencies of THC. And again, the data is pointing to mental health issues. So, the psychotherapy community needs to be aware of this. I think, we have to talk about it. We can't assume that this is a safe drug. And I think therapists are another great place, to be able to talk to young women about this use, and to play a role in, I call a lot of these herban legends. There's legends about this herb that may or may not necessarily be true. And so, getting the facts straight is really important.
Yes, I agree. Would you possibly have some literature that we can reference maybe on this podcast or just have some sites that people can visit that we can reference?
Are you talking about on the topic of pregnancy specifically?
Yes.
Well, I know the
Yeah. Is there
California
any?
Department of Health is really trying to get the word out. I'd have to send you those references, but you can probably, easily do a search
Great.
and find it.
Yeah.
There's been a couple of these studies have come. One came out of UCSD. One of our prime addictionologists, Dr. Carla Marienfeld, was on a publication that, it was trying to bust this myth of it being safe in pregnancy. And, does it contribute to any problems in labor, low birth weight, transitioning of the infant from intrautero to extrauterine life? There's still big questions. And the, one reason is this, it's hard to study all this.
Right.
And especially in pregnant people, you can't give it to pregnant people. We know it doesn't cause malformations, physical malformations that you can see, but it's these developmental things having to do with the brain that are the biggest concern.
Yeah, that makes a lot of sense. I'm of the simple mindset that if it wasn't something we evolved with or, that we saw in our evolutionary process, it's probably something we got to question. And I think any substance falls into that, anything that has not been something that's been part of our, natural development is something we just need to make sure that we have the right information. And cannabis.
Well, and cannabinoids have been in our evolution and we evolved with them and they're in our environment, but not at this potency.
Exactly. That's what I meant. Thank you for clarification. Yeah, you're absolutely right. Yes. So this has been, definitely. And the endocannabinoid system is how we evolved, but not this more potent THC content. And thank you for clarifying, because that's what I meant.
Kind of on a spectrum, there's toning, there's hacking, and then there's just down regulation of the system.
Right.
So stay on the toning end.
Right. And again, you referenced exercise before with that, right? So exercise being your example. And I think that's a really good point. Like we exercise to tone and to have that balance. And I think that's the same for this system, right? Is that what you're referring to?
Yeah, and exercise tones our endocannabinoid system. We've always thought of the opioids being produced when we exercise, but endocannabinoids get boosted with exercise. So they're part of our feel-good internal mechanism. So, boosting that system naturally without hacking it with too much cannabis is the best strategy.
Absolutely. Well, thank you so much for that information. All of this, it's been a wonderful talk. I feel like I really gained a lot of information and knowledge personally. And, it helped, with my confusion, because of course I'm looking at literature and noticing these things. And if I'm noticing it, I'm sure other people have as well. So really appreciate you being on the show, Dr. Sexton. It was a pleasure. And I look forward to speaking to you again in the future.
Thanks so much. I enjoyed it as well.
The information and advice offered is not intended to treat or diagnose and is not meant to replace any other professional consultation. If you'd like to know more about the San Diego Psychological Association, go to our website at sdpsych.org. That's sdpsych.org. Thank you so much for tuning in. Until next time, take care of yourself and be well.